Buoy Health Insights, Swollen Mouth. Hello everyone, and welcome to another insightful episode of Buoy Health Insights. Today, we're delving into a topic that can be both uncomfortable and concerning: swollen mouths. Whether you've personally experienced it or know someone who has, understanding what causes a swollen mouth and when to seek care is important for your health. Let's get started by talking about the common characteristics of a swollen mouth. Typically, if you're experiencing mouth swelling, you may notice swelling of the lips, tongue, and throat. Inside the mouth, there might be a red, sore, or blistered appearance. You could also feel a rounded lump that could be either painful or painless. This swelling could make speaking and other mouth functions, such as eating and swallowing, quite difficult due to dryness, pain, and swelling. Additionally, you may experience soreness and swelling of the roof of the mouth. Now, who is most often affected by this condition? It's seen more commonly in people who smoke or those who do not practice good oral hygiene. But remember, the severity of mouth swelling really depends on the underlying cause. For instance, temporary irritation from foods or beverages is usually not serious and will heal quickly with a little care, but is moderate if there is unexplained or persistent mouth swelling that causes pain or difficulty with mouth functions. In severe cases, sudden swelling, throat tightening, and difficulty breathing need immediate medical attention. So what could possibly cause your mouth to swell? A myriad of conditions can be the culprit, including allergies that could be due to foods, medications, dental products, skincare items, or insect bites, which sometimes lead to anaphylaxis, a severe allergic reaction. Traumatic causes like a sports injury, dental treatment, surgery, or accidents causing trauma to the mouth. Infectious causes, such as bacterial infections that could lead to abscesses, viral infections like cold sores, or more serious infections like Ludwig's angina. Illnesses like viral illnesses and sinus infections, which might also contribute to the swelling. Blocked salivary glands, which can result in the formation of a cyst, a painless swelling appearing in the cheeks or floor of the mouth. Redness, soreness, and swelling from repeated exposure to irritants, for example, cigarette smoke, alcohol, or spicy foods. Inflammation due to conditions like gingivitis or from treatments like chemotherapy. Less common causes like hereditary swelling or growths like tumors can also cause swelling in the mouth. Now, what other symptoms might indicate these causes? For allergies, you may also experience swelling in other parts of the body. With injuries, you might have bruising or tenderness around the affected area. Infections often come with fever, pain, or pus formation. And for illnesses like sinus infections, symptoms could include headache, fever, and nasal congestion. When it comes to treating a swollen mouth at home, consider reducing or eliminating tobacco use, cutting down on alcohol, practicing good oral hygiene, and protecting your face during sports with mouthguards or face masks. But remember, some situations call for immediate professional care. You should see a doctor for any unexplained or troubling lump or swelling, especially if you have accompanying pain, fever, or feel like your throat is constricted. And it's crucial to seek emergency care if you're experiencing symptoms of anaphylaxis, like difficulty breathing, rapid heartbeat, a rash, or a feeling of panic. Your doctor might ask questions like, what part of your mouth is swollen? Do you have a rash? Does your throat feel itchy or irritated, and are your symptoms worse while eating? These are important to consider as they can guide the diagnosis and treatment plan. That wraps up today's episode on swollen mouths. Remember, understanding the symptoms and causes is the first step to addressing this uncomfortable condition. Seek medical advice when necessary, and take steps at home to maintain good oral health. Before we go, don't forget to like and subscribe for more Buoy Health Insights. Stay healthy and see you in the next video.